Hi, this is Mona, psychiatric mental health nurse practitioner with Insightful Psychiatric Mental Health. I wanted to come on here and tell everyone that September is Suicide Prevention Month. And I think it's important that we talk about ways that we can help as a community, people that might be at risk of suicide, thinking of hurting themselves, and find themselves isolated. Oftentimes, the loved ones of these individuals really don't know how to support the individual that's suffering from these kinds of thoughts and impulses. So let's talk about it. Let's talk about first the risk factors. Some of the risk factors for suicidality include a history of suicide attempts. So if this person has ever tried hurting themselves, ending their life before, they are at a greater risk for this again. A history of any suicide in the family can also be a risk factor. Substance abuse, drinking too much, using drugs, obviously, can also contribute to suicidality. A history of any kind of mood disorders, depression, anxiety, bipolar disorder, all of these can be risk factors. Access to lethal means, that's a big one. So does this person have access to any weapons that they can use to hurt themselves, or any kind of prescription drugs that they might use for overdose? Losses and traumas. So sometimes these individuals will have, a significant loss, end of a relationship, the death of someone close to them, any kind of physical, sexual, emotional trauma can also contribute. Bullying. This is especially critical to note for our younger people out there. So this can relate to not only kids in school, but college students, even bullying in the workplace can contribute. Chronic health issues is another factor here. So people living with long-term chronic health conditions, it can be extremely taxing emotionally, physically, and it can also put them at risk for suicide. Exposure to suicidal behaviors in others. So sometimes we see this in school-aged kids, where if there's a suicide in the school, other kids might get triggered and think about suicide or try acting on hurting themselves as well. We also want to look at those folks that have suddenly become more socially isolative. So these people stop talking to their friends, their family. They might stop coming out to social events. They might start missing many days at work. So these are all things that we need to look at. Moving on from risk factors, let's talk about some warning signs. So these are warning signs that you see in people that are either close to acting on those thoughts or having those thoughts quite regularly. So these people might be talking about death or dying or even suicide quite often. So we want to make sure that we kind of pick up on this and make sure that we know that this is a warning sign and it needs to be taken seriously. These people might also start expressing feelings of hopelessness, helplessness, and also worthlessness. So a lot of negative self-talk is also a warning sign. They might start making statements like, I'd be better off dead, or everything or everyone would be better off if I wasn't here. Again, withdrawal is a huge sign. Increased impulsive behavior. So these are people that might start acting on impulses and not thinking about the risks or the consequences. They might express that they feel like a burden to their friends or their families. They might also start having dramatic mood changes. So these are all some common signs, warning signs of someone who might be thinking about or planning on acting on any suicidal thoughts. So as a community, as a family, as a friend, what can we do to help? I think the simplest thing we can do is, if you are concerned about someone close to you, just ask. Ask the question, are you feeling suicidal? Are you having, suicidal thoughts? And if the answer is yes, the follow-up question should be, do you think you're gonna actually act on those thoughts? Do you have means do you have a plan to act on those thoughts? And again, if the answer is yes, they need help immediately. Take them to the ER, take them to the nearest psychiatric hospital, or call 911. Another thing we can do is check up on them. Either go there physically if they don't live with you and spend some time with them, or call them on the phone. Sometimes just venting their feelings, their struggles, their thoughts can be quite therapeutic. So check in on them. Another thing you can do is take away any lethal means. So, if they do have any weapons at home, any guns, knives, sharp objects, let them know that, you'll be holding on to these and taking them away until they feel better. Also, what you can do is if they have prescription drugs that, they're thinking about maybe overdosing on, take them away, hold them. Let them know that you're going to hold on to them safely. And again, once they're feeling better, they can get those materials back. Another thing, again, is getting them help. Sometimes when you're in the thick of depression and it's to the point where you're feeling so hopeless and you're thinking about suicide, just even making a phone call to the doctor can be quite burdensome, and it's just too much. So if you can give a call, make an appointment with their, psychiatric provider or with a new provider, or to, a crisis center, make that call for them, make that appointment, take them to that appointment, because again, every simple task like making a phone call and an appointment can seem like too much at that time. All right. So this brings me to, if you do know of someone who's in crisis, is feeling suicidal, then there is always the crisis line you can call, which is 988. Okay, this is the suicide and crisis line. You can call 24/7, and there's going to be somebody there to help. And if need be, you can always go to your nearest emergency room. You can call 911, but please do reach out and get help. Okay. Suicide is nothing to joke about. It's nothing to take lightly. Anyone and everyone could be at risk. And this is the time that we show empathy, kindness, and non-judgment. If you already have a medication provider, then you might want to contact them as well. But again, if someone is actively expressing a suicidal ideation, which means even thoughts of suicide, a plan, and not being able to say that they won't act on those thoughts, this is the time to take things seriously and get help immediately. I hope this was helpful. Again, my name's Mona Habib. I'm a psychiatric mental health nurse practitioner with Insightful Psychiatric Mental Health. If you have any other questions, please visit my website, www.insightfulpmh.com. Bye-bye.